February is National Cancer Prevention Month. This month encourages communities across the country to educate themselves on cancer. According to the National Cancer Institute, there were more than 2 million new cancer cases in 2024. Our Logan Riggenbaugh spoke with an oncologist from WVU Medicine Camden Clark Medical Center about how to find and treat cancer.
Cancer can grow on any organ in our bodies. The most common types of cancer are lung, colon, breast, and prostate. Some types of cancer tend to have a higher mortality rate, such as pancreatic, gastric, and any type of brain tumor. There are 4 stages of cancer. The severity determines what stage the cancer is in. Dr. Sabir Hussain, an oncologist with WVU Medicine Camden Clark Medical Center, says it's important to have regular doctor visits.
It can affect them emotionally, like it is not only the patient, the whole family emotionally disturbed when someone diagnosed with the cancer, especially advanced stage cancer. Emotionally, financially, socially, it can impact a big effect on the family and the patient.
Regular screening can help find cancerous tumors. Screening can include OCT scans, CT scans, pap smears, and colonoscopies. If cancer cells or tumors are found, a treatment plan will be discussed. Dr. Hussain says cancer takes a toll on the families of the patients.
And having regular visit to their primary care doctor to make sure that whatever screening is available, to avail that screening, especially if they know that there is family history of cancer, certain kind of cancer needs certain kind of special attention. So that is important. So healthy living, regular follow-up with the primary care, screening program, those are very important.
The treatment options are surgery, radiation, chemotherapy, and immunotherapy. Many factors such as age, overall health, and cancer stage determine what treatments will be used. Reporting from Parkersburg, I'm Logan Riggenbaugh for WTAP News. This is home.